Hello guys, so today we are going to study cervical vertebra. So let's go. How do we identify the vertebra as cervical or thoracic or lumbar? So to identify cervical vertebra, there is a presence of foramen transversarum. The one which I'm coloring in red is the identifying character of cervical vertebra. The cervical vertebra is differentiated from the thoracic vertebra by four ways. The first one is that the body of cervical vertebra is quite smaller. Then the vertebral canal is quite larger, and the spinous process is bifid, horizontal, and small. Also, one more important feature is there's absence of transverse process. So these are the four differences between cervical vertebra and thoracic vertebra. Then the cervical vertebra is then divided into typical and atypical. The typical cervical vertebra has C3, C4, C5 and C6, and the atypical is C1, C2 and C7. So today we are going to learn about the typical cervical vertebra. So the two holes which you all can see on either side of the body are the transversarium foramen or the foramen transversarium. This is the body which is always placed anteriorly, and the spinous process which is always placed posteriorly. So let's talk about the body. The body is quite smaller. The transverse diameter, that is the horizontal diameter, is quite bigger than the anteroposterior diameter. The superior surface of the body, see, on either side of the body you can see a projection which is called as neuricentral lipping, and then the anterior border, the border which you can see here, is quite lower. The border which you can see here is quite lower than the posterior border. The pedicels, the number 7 is the pedicel which projects posterolaterally, such that the superior vertebral notch, this is the superior vertebral notch, and this is the inferior vertebral notch, are equal. The lamina, the number 10 is the lamina, and the lamina is thin superiorly, and it is thick inferiorly. Then talking about the spinous process, the spinous process is short, it is bifid and horizontal. Now let's talk about the vertebral canal. The vertebral canal is triangular in shape, and also it accommodates the cervical enlargement of spinal cord. The number 9 is superior articulating facet, and 13 is the inferior articulating facet, both of which form the lateral mass of the cervical vertebra. The superior articulating facet is detected posteriorly, and the inferior articulating facet is detected anteriorly. So the superior articulating facet articulates with the inferior articulating facet of the vertebra above. And also from the foramen transversarium, the vertebral vessel passes. So the picture which you can see here shows us the foramen transversarium. Above it is the anterior bar, and below it is the posterior bar. This is the posterior tubercle, and this is the anterior tubercle. This is the costotransverse bar, all of which helps us to understand the muscle attachment of cervical vertebra. So now let's talk about the muscle attachment on the anterior tubercle. On the anterior tubercle, I'm marking it as number 1. There are 3 attachments, namely scalenus anterior, then longus capitis, longus coli. This is the posterior tubercle. I'm marking it as S2. On posterior tubercle, we have the attachment to splenius capitis. So here we had splenius anterior, right? So here on the posterior tubercle we will have splenius posterior and medius both. And then the fourth attachment will be to levator scapula. The body we have here, we have two attachment. One is to anterior longitudinal ligament and second is longus colli. The attachment was seen over here also, longus colli on the anterior tubercle. Okay, so and on the posterior part of the body here we have the attachment to posterior longitudinal ligament. Then talking about the lamina, this is the lamina. The lamina, and the lamina has attachment to ligamentum flavum. So these are the attachment of cervical vertebra, and we are done with typical cervical vertebra, that is C3, C4 and C5 and C6. Stay tuned for a typical cervical vertebra. Thank you.